Good morning. It's 8:30 and on a Tuesday, and you know what that means. It's time for Talk with a Doc. Today, of course, Dr. Tim McKnight from Trinity Twin City Hospital is here, and this morning's Talk with a Doc is sponsored by Mako's Pharmacy, located at 241 East 3rd Street in downtown Eurexville. Mako's Pharmacy is your local pharmacy with a caring and knowledgeable staff that is focused on your health and wellness. And Dr. McKnight, how are you this morning?
Doing great.
Good. You. Kind of a different change of pace. We've talked about the pandemic over the last several weeks and how to deal with it. I had a listener request a topic. Actually, I couldn't answer some of the questions the listener had. I said, well, this would be a good topic. I want to talk a little bit about arthritis.
That's a great topic.
And can you kind of fill us in on what arthritis is exactly?
Sure. Arthritis is a chronic inflammatory problem that happens in the joints, and often it happens after repeated injuries. There's different types of arthritis. Rheumatoid arthritis is an autoimmune condition where the body sort of attacks the joints, but most of us suffer from osteoarthritis, which is repetitive overuse or a traumatic injury to a joint. And eventually, over time, with those repetitive injuries, the joints start to get inflamed, and when they get inflamed, we don't want to move them, and we don't move them. They become stiffer, and we have more pain and swelling, and that's when we're starting to, go to a doctor and talk to somebody about what can we do for this? How do we treat it?
Yeah, one of the things too is the differences. I mean, how can this be discovered? In other words, what's the difference between having some joint pain versus arthritis? How can that be not treated, but how can it be discovered?
Well, I mean, I guess the best way to do, when we're talking about osteoarthritis, an X-ray will confirm that. But if you're starting to have joint pain someplace and there's some swelling and stiffness, usually that stiffness, morning stiffness, is the telltale sign, because as we get moving with the joint and it starts to feel better, that's a pretty good indicator that we're talking about osteoarthritis.
And it affects anybody, correct?
It will affect all of us at some point. We just have to be prepared for it and know what to do when it happens.
As you get older, as I have, you start noticing a little aches and pains when you go out and do some things, and those are different. But when it's chronic and it's your hands and fingers and your thumb and just all the joints that you use quite a bit is in constant aching pain, that's got to be an indication that probably some type of arthritis.
Exactly. And I've had recently on my right hand, my middle finger, a lot of pain and some swelling in the morning. And when I was little, I played catcher in Little League and had a lot of balls hit that finger straight on. And then later playing basketball, same thing. I think I've had a fracture or two in that joint. So that's an arthritic joint for me. And what's interesting to me is I use that inflammation as an indicator of if I'm doing the right things from a dietary standpoint. Because if I'm not, if I'm eating inflammatory foods, sweets and high-fat foods and the wrong type of additives and preservatives, I have more pain and swelling. So that's an indicator. It's kind of like slap yourself. You're making bad choices here because it's making it worse.
Yeah, and interesting. Several years ago, I was moving a file cabinet and hurt my shoulder really bad, and of course they went through the MRI, and I found out that everyone has torn ligaments and torn tendons because if you do anything, throw baseball, throw football, or anything else. And I thought I was going to have some major surgery, and the doctor says you have more of a problem with arthritis. So he gave me a shot, in the shoulder, and he said this may last a week, a day, or forever. And that was 7 years ago, and I've never had any pain. And so that's a lot of times that it could, you think it may be a lot worse than what it is. Not to say that arthritis isn't bad, but it's better than having your shoulder redone and things like that. And you get a good doctor that can able to figure that out.
Absolutely. And those shoulder injuries, a lot of times those are inflammatory problems in the muscle, micro tears in the muscle. But what you're talking about is the arthritis at the joint between the shoulder blade and the collarbone. That it's the acromioclavicular joint, the AC joint, and that's a pretty common one for people that have done a lot of throwing. Yeah. But really, the question is, what do you do with this chronic inflammatory problem? And when Dr. Jakubowski was here a couple of weeks ago, we talked about the fact that movement is key. You've got to keep moving these joints. If you listen to them and you don't move them because they hurt, over time the body will lay down more calcium in those joints and then become stiff and they become more immobile, and then they don't work. This often happens in the low back. People that have low back pain, low arthritis there, if you don't move through that and stay active, that'll stiffen up, and you'll actually calcify that lumbar spine, and then you won't be able to bend down and get your ball out of the cup on the golf green, those kind of things.
Yeah, and the it goes along with, as far as treatment goes, some other treatments that may help ease that. Is there anti-inflammatories? Is there supplements that can help?
That's a great question, and I'm always in favor of foods and supplements over prescription medicines or over-the-counter medicines. So what I do is I take 2 turmeric supplements every day. Turmeric is a great Indian herb from the curcumin plant, and it has very good inflammatory properties. Glucosamine chondroitin is also a really good one for joint pain. Glucosamine chondroitin adds some of the lubricant back to the joint. That's one of the constituents or components of the joint fluid. So those are 2 real natural approaches. And then I'll do other things like vitamin C and vitamin D. They all have anti-inflammatory properties. And then, of course, you've got to eat a healthy diet. If you eat a diet rich in fruits and vegetables and nuts and seeds, that helps to reduce the inflammation. On the other side of it, if it's a lot of sugar and processed foods and acidic foods, that causes more inflammatory and joint pain. So you want to avoid those. The next step up would be over-the-counters. Like for me, I do really well with ibuprofen. 2 or 3 ibuprofen when my back is really stiff really takes that pain away. But you have to be careful with these, because if you use them chronically and you take them on an empty stomach, they can cause ulcers. They can cause kidney problems. So you really don't want to take these too often without talking to your medical provider. And then the last line of therapy would be, some of the prescription drugs. Meloxicam is a good one that some people get relief with, but some people really struggle and have pain in spite of all those other approaches. And then we're talking about chronic pain medication at a chronic pain clinic.
Well, does the weather affect arthritis?
Yes, it does, and nobody has a good explanation for that. I think personally it's the change in the barometric pressure that the joints somehow can sense. People say, well, we're going to have a storm because I can tell my back is starting to hurt. I think it's a barometric pressure change, but I'm not sure how you explain that physiologically. But yes, that's very, very commonly seen.
The other thing is my wife had a grandmother that had arthritis so bad that her fingers were turning different ways. And is that rheumatoid arthritis, or is that just a different type?
Well, rheumatoid arthritis typically affects the knuckles between the fingers and the hands. And what you'll see is a deviation or a movement of the joint away from the midline of the body. So towards the outside, when the joints move to the outside, that's typically rheumatoid arthritis. When you're talking the last knuckle on your fingers, that tends to be osteoarthritis, and there's just wear and tear.
She was good natured about it. She would, because she had her fingers were just hard to look at, and I thought, boy, that just got to be painful.
Yeah.
She was so good natured. If somebody slammed a door in front of her, she'd yell and hold her hand up, and the poor person would just have a panic attack, thinking he messed her, or broke all her fingers or whatever.
Yeah.
So.
Well, you see these people that have that type of arthritis, and some of them will get joint replacements to straighten it out. But that's a pretty painful condition, and typically for those, a lot of times we'll use steroids, or we call them immune modulators, that are pretty powerful drugs to just help them manage the pain better.
And again, arthritis can be in any part of the body that you have bones and joints, correct?
That's right. Yeah, exactly. Wear and tear.
Wear and tear. Okay. Dr. Timothy McKnight, he's the expert. We have different topics that we may go over in the next few weeks. And Dr. McKnight, thank you for coming in today.
Welcome.
Look forward to you next week.
Great. Thank you, Robert.
This morning's Talk with the Docs brought to you by Mako's Pharmacy. Mako's offers their customers and community free assistance with comparing and selecting a plan based on your specific prescription needs. Call Mako's 740-922-7400.
Mako's Pharmacy is your locally owned and operated pharmacy with a caring and knowledgeable staff that is focused on your health and wellness. Mako's provides free prescription drug counseling, flu, pneumonia,